Hello and welcome to this special Warrington Health Scrutiny meeting to look at the spinal services in Warrington. And Adam, do we have any apologies for the meeting?
Yes, Chair, we have apologies from Councillor Carter.
And does anyone have any interests that they would like to declare at this point? Okay, that's it. Silence, as I know. So the item on the agenda is for us to have a look at the spinal surgery services and Warrington CCG. So, Carl, are you going to speak to this presentation?
Chair, was going to run an intro and then hand over.
Kick us off.
Okay, do you want to, Andy? Are you going to give the intro?
More than happy to, Chair. So thank you everybody for coming together to consider this one more fully. Obviously it's been going on for a while. I think we first wrote to the OSC in October 2017 about changes that were required for spinal surgery, particularly the more complicated end of the spectrum. And since then there's been measures put in place to ensure sort of continuity of service for patients and aim for those goals around local entry to services and excellence in outcomes for them. And to help explain where that journey that we've been on over those years and to the decision point that we're at now about mobilising the final form of the service, I've brought along with me Carl, who's been shepherding us through that process as our representative on the regional board that's been looking at spinal services along with specialised commissioning, and also Andy Nicholson, who is the medical director for the Walton Centre, and Simon Constable, who we all know and love from our local hospital, to talk about that. So I was going to hand over to Andy to talk through a bit about the clinical model, and I think he's going to hand to Simon, who then passed to Carl just to talk through, and then we can probably have a good conversation about where things are up to and any outstanding matters that the committee wants to raise. If that works for you, Chair?
That sounds like a plan.
A bit of choreography there, look at that. So I don't know whether Andy's made it onto the call. If not, we could probably go straight to Simon if you're ready to go, Simon.
Yes. Thank you, Andy. Yes, I think Andy. So Andy Nicholson's medical director of the Walton Centre is having technical trouble connecting in. So I think, if I may, I'll speak on both of our behalves, because as Andy says, we've been working really very closely with each other, both from a commissioning point of view and a provider trust point of view, both Warrington and Halton Hospitals, the Walton Centre, what is now Liverpool University Hospitals, as the three providers of spinal surgery services in Cheshire and Mersey. And this is something that obviously has been a long time in coming. So I suppose if it's helpful from the outset, I think it would be helpful for me to state, as both the former medical director and chief executive of Warrington and Halton Hospitals, that this trust has been very much engaged with the development of the single spinal service for Cheshire and Merseyside over the last few years, and it has certainly been a long time in coming. We've been fully involved with the steering group and the Spinal Services Provider Board, working extremely closely with commissioners and the other two providers in constructing the right model for Cheshire and Merseyside, and especially with relevance to what it means for Warrington and Halton Hospitals, given the fact that we have been a player, a provider in that in that field for a number of years. I think what we've got to is a good model with a lot of engagement and a lot of discussion with all of the stakeholders, underpinned, I think, by the recommendations that emerged from the Getting It Right First Time report that colleagues might remember references to in the earliest stages. And of course, I have history here in having been sitting in front of Health Scrutiny Committee previously, talking about the suspension of spinal services at Warrington and Halton, and it is important to note that we've also taken into consideration, and we said that we would undertake to do that, to include the the RCS recommendations on from the Warrington Halton service into the future model design. So things are slowed a little bit because of the impact of the COVID-19 pandemic, it's fair to say, but as you might expect that. But I think what has been created has been a genuinely collaborative approach that is a good beacon of how we intend to work in the future to deliver a full service of spinal surgery provision that will include a full spectrum of no interventions to the more complex orthopaedic and indeed neurosurgical spinal surgery service that can be provided through a centralised hub model, allowing the provision for some local access. And I do envisage that local access will be through outpatient clinics locally, as well as what's required in terms of complex surgery occurring in the centre of Liverpool. So in essence, I think this is the right thing to do. We support it as a trust. There is a full spectrum of spinal surgery services to be provided, and at the top end of which it is the right thing for complex work. However you want to describe that complex work, to be done in a centralised centre of clinical activity where volume and standards and expertise is centralised with all of the relevant partners. So I think that's probably all I would say at this particular stage. I think that what we've got to is a good position, and I would advocate it to members of the committee. So happy to hand over to Carl now to take us through the slide deck.
Thanks, Simon. Okay, Carl.
Thank you, Simon. Thank you, Andy. I was on mute again. Has Dr. Nicholson not been able to get in, Adam? I'll assume not, and I'll carry on. So we shared a paper that summarised the slide deck, and I will quickly work through the slide deck, calling out some of the highlights. And I think Simon and Andy have teed us up well with some of the key concepts. So next slide, please, Adam.
And Carl, would you like to have questions as we go through, or would you like them at the end?
I think we were anticipating having them at the end, and hopefully
Right.
Dr. Nicholson will have joined us by then, hopefully, so we'll be able to provide some of the clinical input. So if I whiz through this, so this is obviously, as we said, about reconfiguration of spinal services across Cheshire and Merseyside, with the aim of improving those spinal services and having a single service model, as described by Simon, for spinal surgery in Cheshire and Merseyside. The context of that is that spinal services provide treatment for a diverse and complex range of conditions, and these can range from disabling spinal pain, correction of congenital spinal deformities, and complex surgery. So the steering group that Simon talked about, that we are both members on, and I represent Warrington CCG on that, and have done from the day I arrived nearly 3 years ago. The vision was to improve spinal service across Cheshire and Merseyside, be recognised internationally as a leading spinal provider, and I think the plans we've got go a long way towards that, and integrate all spinal provision across Cheshire and Merseyside with a lead provider, but also ensure that patient choice is unaffected by this development, and other providers offering services will be available. So I will tease that out in a little bit more detail as I go through. Next slide, Adam. So just probably for me this one, but there are some experts in the room who can give us detail on this if we need them to. So the management of back pain is not all about complex spinal surgery. So the overwhelming majority of people with back pain can be managed conservatively within Warrington-based services, and that is where most referrals start. So with our musculoskeletal services and from GPs. some of the pathway we'll be talking about could be from A&E, but they are very, very small numbers. And a small number of those require specialist opinion, and some of those may require a surgical intervention. And there's some real clear guidelines on what that should look like. And there are things called evidence-based interventions, which set out for providers and commissioners specific criteria to ensure good surgical outcomes. And there are evidence-based interventions for spinal services. Next slide, please. So as Simon pointed out, we had a getting it right first time, so a GIRFT review, and GIRFT are a recognised national improvement programme for hospital delivered services, and one element of that was the MSK, and within the MSK were spinal services experts that looked at services across the piece, and the recommendations made at the time were that complex spinal surgery should take place on a single site and be co-located with major trauma services. Elective surgery should be performed at scale. The development of a single on-call rota for out of hours and emergency consultation cover, and that deformity surgery should take place at scale within a single MDT, multidisciplinary team, and should be co-located with cancer services. Oh, Adam, I'll let our guest in. Sorry, Adam, could you go back one, please? Okay, this is alongside the implementation of a national back pain and radicular pain pathway. Now we have that in Warrington, best practice, the start back pathway. A journey, there is still an element within that, the psychological component that we have, but we would like it stronger within the pathway. So the majority can be used conservatively, and within that pathway we've been developing this, working with the Vanguard programme with Walton Centre. That still has a little bit of work to do, but the majority of that pathway is now in place. Next slide, please. And so the background to spinal services, can everyone hear me? Because I'm getting my bad signal network again that I normally get. Hopefully I'll keep going unless somebody does a thumbs down. Thank you, Simon. So spinal services are required to be commissioned, 2 commissioners, the CCG for non-complex and specialised commissioning for complex services. And across Cheshire and Merseyside, as Simon has pointed out, we had 4 providers: Aintree, Royal Liverpool, the Walton Centre, and until 2017, the Warrington service. Adam, next slide. And so as part of the steering group, with the vision and with the recommendations of GIRFT, we looked at what the options are to meet our vision, but also those recommendations. Can I keep going? I thought I heard somebody, and that might be feedback. So the 4 options were: do nothing. Option 2, development of a brand new hospital site for all spinal surgery in Cheshire and Merseyside. Option 3 was all emergency spinal surgery to take place on a single site, with all elective surgery taking place at a different single site. And then option 4, which was the desired option of the steering group, was all neuro and orthopaedic spinal surgery to be carried out at a single site. And this single option for Cheshire and Merseyside would be on the Aintree and Walton site. And that was the chosen option because it meets all of the criteria set out in the GIRFT recommendations. As part of that, and Simon talked about this as well, is that there's an aspiration within that prime provider model on a single site, but also to provide services locally where we can. And the aspiration we're exploring is outpatients at the Halton site, and in the fullness of time, that could be non-complex procedures as well. So there is an aspiration, and that is on the work plan for the steering group to consider. Next slide, please, Adam. And so this slide just talks about the model of care and details what that would look like under option 4. The Walton Centre is already co-located with the Aintree Hospital site, and the Aintree Hospital site is the regional major trauma site, and as you will recall, that was one of the main GIRFT recommendations. The Walton Centre in Cheshire Merseyside is the only site that could provide at-scale outpatients, non-complex spinal surgery, along with complex spinal surgery and emergency spinal surgery. It enables the implementation of a single pathway for emergency spinal with access to 24/7 diagnostics, and provides a concentration of both specialist neurosurgeons and orthopaedic surgeons to give that single multidisciplinary team. And as I've said before, there is a aspiration within that, an opportunity within that, to provide services under this service at the Captain Sir Tom Moore building. Next slide, Adam. And so one of the things that we've considered, and this has been considered at length by the steering group, is the impact on people. And for us, that's the impact on the people of Warrington. And the key driver for that is providing safe and effective world-class complex spinal services for the people of Cheshire and Merseyside. And our job is to make sure that that is also for the people of Warrington. So an equality impact assessment was undertaken that identified that travel for Warrington patients could be a potential issue. But since that time, the majority of people, and when I get to the data bit, I will tease this out a little bit more. The majority of people accessing spinal services from Warrington have been travelling to the Walton site already. I've already talked about aspiration around services at the Holton site. Patients transport, so these are mitigations to that transport issue. Patient transport services, they are well developed. We increased the activity of our patient transport services, and one of the things will be really understand what the transport issues are and make sure that we can mitigate those, and also to ensure the ongoing monitoring of the service so that we can make sure that any challenges that we've mitigated continue to be mitigated. Adam, next slide, please. So as part of the steering group, there was patient engagement. I won't read all of these out, but it was conducted to inform the development of the single site option. But when people fed back, they really liked the idea of a centre of excellence. And the thing that really came out was that continuity of care, that your consultants follow you, not the other way around. And they're the key things that came out of the patient engagement at the Cheshire and Mersey level. Next slide, please. And then, so our local engagement plans to gather insight and patient experience from the Walton Centre PALS team. That is ongoing for both Warrington and Holton patients because we share the same PALS team. We're engaging with NHS Warrington CCG Health Forum, which is our patient sounding board. Targeted work with the Walton Centre to seek patient experience from patients who've had spinal surgery, and working with the Cheshire Spinal Injury Association to organise a focus group so we can take soundings. And this is being supported by Healthwatch Warrington. Next slide, please. So this sets out our duty to involve. I won't step through that. I'm sure if there are questions on that, we have Maria, who is our resident expert. The key thing for me is around the number of patients. So as we said at the beginning, the vast number of people with back pain are managed conservatively. When we try to look at a typical year, that's quite hard to do. This year is not a typical year, and we've seen our numbers for complex spinal procedures reduce. But looking at our numbers, turning that into people, because not all procedures are unique patients. In a typical year, whatever a typical year is, in 1920, we had 72 people had a spinal procedure that required them to have an overnight stay. and the majority of those, because it's a choice pathway, choose to have that at the Walton Centre. 10 were at Salford, and when we map that, that's from the sort of limb edge of the Warrington footprint, and 4 were with a Pioneer, and 4 also at Spire Liverpool, and that's because of choice. But we are seeing those numbers of the providers starting to reduce. Next slide, please. And so that's the Simon's plan, and I guess it is Simon's kickoff at the beginning is recommending this service to Health Scrutiny, but also to have a discussion and get into try to answer any questions that we can here, but maybe take those away as well, but also build into that the forthcoming patient engagement that has already started.
Thanks very much, Carl. I realised that Dr. Andy Nicholson has joined us. Is there anything you may wish to add? I know that you've missed what Simon's had to say and most of what Carl's had to say, but is there anything that you wish to add before we ask some questions?
No, can I just check that you can hear me first of all, because I've had technical difficulties.
Yes, we can, yes.
Excellent, excellent. Sorry, I've had to dial in my mobile phone. So I did actually hear most of what was discussed there, and I would just endorse what both Carl and Simon have said, really, that this has been a joint effort to get to this point of working together with providers and commissioners across Warrington and Liverpool. And, you know, I think Simon summed it all up very well, really, that I think the clinical case for this is strong, and we've worked together on this to come up with what we think is the best solution for patients across the Cheshire and Merseyside region. And I think for the relevance to the Warrington patients, we've been very conscious of seeing, you know, we're aware that the service was there prior to 2017 and hasn't been since. We're keen to get back to a point where we can provide outpatient care in the first instance for the patients of the Warrington area. And we think that that's very, very doable once we can move forward with this. So we're certainly conscious of trying to be able to get back to a position of providing some care closer to home for the patients of the Warrington area.
Okay, thanks very much for that, Andy. Does any of the committee members wish to ask any questions to either Simon, Andy, or to Carl?
Hello, Paul.
Yes.
It's Councillor Wheeler.
Oh, hi, Judith.
Hi. Sorry, I did miss the beginning of that. Apologies, because I was coming home from work. I don't think this was probably mentioned. How does a triage system work? Would that get done at Warrington and then somebody would move over to Walton, or would a judgment be taken that a person with, you know, a potentially serious spinal injury goes straight to Walton if it's not elective or planned surgery? You know, it's trauma related.
Should I take that one? It's Andy Nicholson from Walton. If there's an acute presentation with a spinal problem, whether it's trauma or any other acute spinal problem, that would come through the regional on-call service, which, if the patient is admitted to a local trust in Warrington, then the on-call team would discuss that with the regional on-call at the Walton Centre, or it could possibly come through the regional trauma service as well. So acute things would continue as they are currently with the emergency 24-hour on-call service that we currently run. For elective procedures, or elective care, it's going to depend very much on the nature of the problem, in that we'd still be keen to have, as Carl I think outlined, a process for the vast majority of people with back pain who don't need to see a spinal surgeon, and we're very keen to demedicalise this where possible and implement the national back pain pathway and get this looked at by the appropriate practitioners in the first instance, which would largely be non-medical, so often physiotherapists. But we'll have a more centralised triaging system at the Walton Centre, where we're picking up on the patients that do need to see a specialist with a view to whether they need any surgical intervention. So we have to link those two services up, and that's something that we'll be doing in all of the areas within the region.
Yeah, thank you.
Does anyone else have any questions?
Paul, can you hear me? It's Councillor Hall.
Okay.
Yeah, I've got some questions. Hiya. Just in regards to the report that was sent around to committee members about engagement. 5.3 of that report talked about a virtual focus group, and I just had some questions regarding that, just in terms of where those patients were based and how many of those patients were spoken to. It was a bit of an overview, a bit of a broad brush, rather than kind of giving us more of an indication of what people specifically thought about the proposals. So I just wondered if there was any answers to that, just in terms of Warrington residents. I know there's talk about Healthwatch conducting engagement later on, but what level of engagement with Warrington residents have there been so far?
So, Chair, could I suggest that Maria answers that one, because she'll have the detail.
Yeah, sure.
Is that okay? Thank you.
Absolutely. Thank you. In terms of the engagement that was undertaken across Cheshire and Merseyside, I think the numbers of Warrington patients that were engaged through that process was relatively low, but that was probably proportionate to the numbers. So, when we see the number of 72 patients which went through the service during that period, that number was probably proportionate with that. However, that's why we built in some additional engagement that we're going to do focused solely on Warrington residents, in line with some support from the Cheshire Spinal, trying to think of the name, Spinal Injuries Association, to identify people so we can do some more in-depth engagement to understand the impact for Warrington residents.
Okay. I think Sarah raises a very important point, and I think from a communication perspective, perhaps this meeting could have been prevented, because the engagement that has gone on with Warrington patients hasn't been great, but the consultation that was given as evidence from 2017 was actually quite a broad consultation, and the information within that wasn't really pertaining to Warrington residents. And I think if the engagement had been more from the outset with people from Warrington, I think the committee collectively would have been much happier, because then within the slide it's saying that there's not a substantial variation. I think there is a case to say that there is a substantial variation, and I think if the committee or the people of Warrington had been engaged, we would have been quite content that this is an improvement in the current service, and I think there is a lesson here to be learnt about the engagement with both the committee and the people of Warrington. So it is pleasing to see that there is going to be some further engagement. Yeah.
Absolutely, Chair. Couldn't agree with you more that actually we need to do some more in-depth engagement focused with Warrington residents, and that's the intention.
Which then, I suppose, begs the question, why wasn't it done in the first place?
The engagement programme that was undertaken across Cheshire and Merseyside as a whole. So rather it's done on locality level, it was undertaken as a wider piece of work, a wider programme, accessing people through various routes. But again, I think we need to look at proportionality, because if you look at the number of patients that have been through the service and the number of patients affected, it would have always been low numbers doing it that way. But I actually think that doing some more in-depth work across Warrington will help to kind of fill that little bit of gap for us that I feel there.
Okay, Thanks, Maria. Does anyone have any other questions for Maria or others?
Yes, please, Paul. Ian Marks.
Hi.
Go ahead, Ian.
Okay, thank you. Yes, I mean, in the presentation, in the equality impact assessment, it talks about travel being as the main issue for Warrington patients, which I quite understand. Can we just hear, is anything proposed to try and sort of ease that and make it easier for people to travel to Liverpool, which for some people is quite a journey, because there's issues about how you get there and getting lost and all these other things if you're not used to going to Liverpool. So I just wonder what's going to be done about that, please.
Should I, can I have a go answering that one?
I was going to suggest, yeah, Carl, I think, because that's been one of the discussion points, hasn't it? Yeah.
And Marie, you might want to jog in as well too. So, Councillor Marks, I tried to tease out on the slides around the patient what are, and I don't think I signposted it clearly enough. What we would be trying to do is put mitigation in place. So one of those is that we have patient transport services that people can access. I guess the challenges around transport are twofold, aren't they? They're not just the person getting to hospital so they can have the procedure, they are family, friends and carers being able to visit, and I guess that's the driver. So for me, the key strands to that are there is still choice. So there is still, if Salford is closer and easier to get to, there is still that choice. There are patient transport services. There are things that we can try and do. I guess the challenge is the volume, and that it will be quite spread across Warrington. And I think that's one of the things that we want to try and tease out with the Spinal Association, with PALS and with Health Watch, as to what are those travel indications. I think, and this is not the answer, but this is part of the answer, that we have patients currently, the majority of patients have a choice and they elect to go to Walton. And I've checked again, and in the time I've been here, we've not had any complaints or issues with transport. And that's not to say so it's fine, but that is part of that intelligence in terms of how difficult is it for people to get there, that we will get a more rounded picture when Maria's team and partners within Warrington have done that read across in terms of those patients that have accessed the service, what their challenges were, full stop, but also in particular with transport services.
Okay, thanks, Carl.
Yeah, absolutely. If I can just add to that, so some of the work that we'll be doing will be focusing in on, because if transport has come up in the equality impact assessment as the likely issue that we need to understand, what does that really mean? What is the level of concern around that? What can we do to mitigate this patient transport, as Carl said? But what else can we consider putting in place? Or it's dependent on the level of what level of an issue will that be?
Yeah. Paul.
Okay, thanks, Maria.
Chair, if I may.
Yeah. Go ahead, Amanda.
Thanks, Chair. I think mine's a continuation, and thanks, Ian, for bringing up the transport piece. I don't think it's very clear what transport is available to certain patients, particularly those with back injuries. Just some of the pieces of casework I've picked up, whether you're going to Liverpool services for cancer services and or for back services. I don't think some of the residents are aware that there is a transport facility available to them. So I think just a clearer communication, especially Maria, when you do your outreach, to understand that that's available to them and organised for them. I'll give you an example. One lady with a brain tumour goes for a regular scan treatment. I spoke to her about her treatment and she said she didn't realise she was available for any transport. So she was getting on 2 buses and a train into Liverpool. It's not acceptable. I don't want anyone with an injury or a severe condition to have to feel they have to go on public transport to such a distance. You know, if you have to get to the Walton Centre from Warrington, is it 2 buses and a train? I don't know. I drive, but and also are we measuring the demographic of each of the patients? Those that have back injuries, are they more likely to be from a inner
part of the town or an outer part of the town? So again, are they likely to have their own access to mobility, or are they in a more poorer demographic? So I think we really need to get down to that crux. So a lot of people don't understand that they've got any form of transport available to them to get to appointments that are in great centres like the Walton Centre. I'm sure it's going to be an absolutely great centre with a centre of excellence, which is brilliant. However, the getting there is a big concern for me personally, and I think for everyone on this call. I don't think just saying it's available is enough. I think we actually need to look at every appointment and then getting back from those appointments, and aftercare as well. Are you able to provide that, or is it too much of a cost? Anyway, so that's my question. I don't think it goes. I don't think your answer went deep enough, but I'd like to see what your results are. Okay.
Chair,
want to respond to that.
I was just going to volunteer an answer if I may.
Go on, Andy.
I think that's fair. I think when we're talking to transport services, there's quite a detailed menu on offer to patients for any outpatients. So some of this isn't specific to the Walton Centre, and perhaps it's worthwhile us sharing that full menu about what's available and what purposes it can be used for, and that includes just funded travel for taxis, for example. If people, it's easier for them to get a taxi, that can be funded if they meet certain criteria. And then there's PTS, which are non-paramedic ambulances that can either pick people up in groups or individually if that's required. But there are different criteria for the different levels of transport, and perhaps if we shared that, that might help with that, because I agree. I think we've got in our heads what we mean, but we're not communicating that to you when we're giving that answer about the transport being available. So we'll take that away and send that through, so that, because that just doesn't apply to this, it applies to all services that we commission. It's a standard offer available to residents.
Thank you.
And just to add to that, Andy, I think probably is something that we can do more to publicise that to the public in general as an overall service that's available for whatever, you know,
Thank
service.
You, appreciate that.
Absolutely.
Yeah. Thanks for that. Any more questions from anyone?
No, just sorry, Paul, it's Councillor. Just anecdotally, I had actually 4 eye operations at the Royal in Liverpool last year, and I went by public transport because you can't drive with eye problems. But on one occasion, they volunteered a taxi for me, and I was actually shocked and said, "Well, you're not going to send a taxi all this way to Warrington, are you?" And they said, "Yes." I hadn't thought about it, hadn't asked for it, and I think that sort of highlights the fact that the citizens of Warrington are not aware of what can be provided when we are having to travel to Liverpool or possibly Salford for treatment.
Okay. It's a learning point there for us all. Just regarding the follow-on care and the outpatients, in the document there's 4.2, 4.3 and 4.4, and it goes from outpatients being an aspiration to being the potential to being the discussions. Which is it?
Should I answer that one? It's almost like we've overstated it, I think, Chair. It's a distinct possibility, and I wonder if Andy Nicholson can. But we are seriously looking at that. Andy, would you be able to give a bit of detail on that one?
Yeah, absolutely. Yeah. So we do clinics for patients with spinal problems in other parts of Cheshire and Merseyside, but up until this point we haven't done that regularly in the Warrington area because of the fact that Warrington had its own service, and so we haven't set up a clinic as yet. But we have had discussions, and that's not a possibility, that's a definite, that's what we would propose that we do in providing. It would start at a smallish level and gradually build up. We've already done some pilot clinics with one of our spinal surgeons has done some clinics in the Cheshire and Mersey Treatment Centre, and just to try and work out some logistics, and that worked very well. So we have a model in place of how we would propose that we do it, and that is the two things. There's probably 3 clinical things that we've discussed that whether we could do locally for the Warrington population. One is outpatient services, and we've no doubt that that can be delivered and gradually built up so that fewer patients have to travel to Liverpool for outpatient clinics. We have some pain interventions, which treatments such as some carefully selected patients requiring injection type treatments, that can also be delivered potentially locally. And then we have less complex spine surgery, which we have discussed, but at the moment that's not on the immediate agenda, but that would have to be something to discuss in the future. So that's the one that's more aspirational. The other 2 aspects I would say are definite that we should be doing. The other points I was just going to make about outpatient services and follow-on care is that one thing that the COVID pandemic has brought us is a huge increase in virtual consultations, and we've been one of the biggest users of video consultations nationally with our neurology and our neurosurgery services. And clearly, as we hopefully get out of the pandemic, we will be able to be seeing more patients face to face. But we're also very keen to continue to use remote consultations where appropriate. So where it's appropriate and where it's clinically appropriate and where the patient would prefer it as well, because a lot of patients do prefer this, we've found, that would also be an option. So I think we would see less in the way of need for patients to travel for outpatient aftercare in particular than the traditional model.
Okay, thanks, Andy. Anyone, any further questions? Okay. If we go back to the your final slide in the recommendation, then Carl, it's just saying that there's the engagement now is going to go ahead. What is the outcome of that? I know you can't preempt it, but what's the outcome of that going to be, and what proposals will come of that? The findings of that, how will that inform this decision?
So, in terms of the engagement, I think that's understanding what the constraints and impact would be on patients that are likely to need to utilise Walton services, and bearing in mind that the majority of our patients get their complex spinal procedures in Walton now. So the plan is that we use that engagement to make sure that the mitigations are correct, that they assist people. So the things we've discussed, as much outpatients locally as we can, that we've got good PTS, that people are aware that they can use taxis, criteria, and using that to make sure that it is that centre of excellence pathway for the people of Warrington.
Okay, thanks very much. Does anyone have any further questions or any comments to make? Okay. Just as regarding that the paper that's going to the CCG governing body, would it be possible for that paper to be shared as well with the committee?
Yes.
Yeah, that would be very useful.
It'll be publicly discussed anyway, Chair. So we'll share that in advance, and it'll be available to the public as well when it goes to governing body.
That's great. Okay, thanks.
Chair, could I just add that the engagement that we're undertaking, the report from the engagement, quite happy to share it with members as soon as we've got the outcome of that available. It's underway at the moment. We're hoping to have an engagement report from that available to you within about 5 weeks, 6 weeks.
Okay. Thanks very much, Maria. Do you think that there's been any lessons learnt from this process then, from a CCG perspective and a commissioning perspective?
So I'm not. I think we were a bit hijacked last year with coronavirus, and with the paper that we presented, it was a bit of a, could we consider this, is that okay? And I fed back to the team that it didn't land in the way that it was anticipated to land, and I think that what has happened is we drifted apart in the understanding of where things were, and that felt like it was being landed as a bit of a fait accompli, which it was never intended to be. And I think there has been lots of good work going on, and more regular touch points over the year I think would have resolved that, in terms of just updating the committee on where we were up to with the spinal work. And if I'm honest, I think partly it just dropped off the radar as a point of concern locally, because everything was going well and it felt like it was all progressing. So I suppose the thing that we need to do is reflect on, if there are decision points coming up in advance of that, make sure we give it the airtime that it needs. And I'll take ownership of that. I think on this one we just sort of missed the impact that was still perceived by the committee, because everybody was kind of in it, and thought that had all been done and was water under the bridge. So coming back to it, we would probably be more mindful of making sure that we get that with you in advance, with a bit more time share.
Yeah, I think the original paperwork before it was circulated to us was available in September, and I think if that had actually been circulated shortly after it was available, then a lot of this would have probably been headed off. But I think taking the positives from this, I think the support that it's received both from Simon and from Andy at the Walton Centre, I think it does show that there's going to be improvements to the service, and certainly from what Carl's saying, it is going to be an excellent service, and the people of Warrington are going to benefit from it. And so it is a little unfortunate that hasn't been communicated as well, but this has been a very good opportunity to air those positive elements of this, and we can only wish that the service wish it well and commend you for the work that you've done. So thanks. Okay, and thanks very much, Simon, for your time, and certainly, and to Andy, Andy from the Walton Centre. Andy Davis has just got to come along anytime anyway, so we won't thank him, but we do.
I know my question.
Thank you. Thank you.
No, I really appreciate it, and I think on behalf of the committee, and also, you know, we're here to protect the interests of the people of Warrington as well. So on behalf of the people of Warrington, we do appreciate the time this evening, and thanks for your continued work. So thanks very much.
Thank you.
Thank you.
Thanks all. Thank you, and I shall